Collecting data and indicators are often associated with meeting funders' reporting needs. But First Nations have collected and used data for generations to share knowledge and make decisions. We asked First Nations health leaders how they utilize data in their work to tell their stories and how it supports the work that they do.
The colonial-based reporting gives maybe numbers, maybe shows utilization, where what we're trying to do is show a story, tell a story, understand a story, recognize the need, look to, okay, well, how long will it actually take us to create this change that was identified where, we think about our teachings, we're thinking about 7 generations ahead and we're guided by 7 generations back. And so how do we make sure that the work that I'm doing today is going to impact those 7 generations in the future? And that's really our way of collecting this information, is to leave something that tells a story. And whose story is it telling? It needs to tell our story, and it needs to tell from our perspective, and it needs to understand that we're not just talking about figures and numbers. We're talking about humans who have spirits, who have, their own journeys that will maybe be impacted by the work we do.
Well, having the proper data to help us accomplish our vision and mission for a community really, moves things along and gets everybody on board and working, in the same direction. It also kind of solidifies any questions that our leadership would have in regards to saying, okay, why are you doing this activity? How come you're doing this? Well, we have the data to support it.
By focusing on strengths and resilience, shifting the narrative from that deficit-based approach to highlighting community strengths and resilience, ensuring that the research and data collection efforts highlight positive aspects of community well-being alongside the challenges. And communities can also celebrate their successes, acknowledge and celebrate achievements in community-led research to build community pride and motivation, host events, ceremonies, or release publications that recognize and share the successful outcomes and impacts. By taking these steps, First Nations communities can actively shape the narrative around their health and well-being, promoting cultural resilience and contributing valuable insights to the broader field of health research.
We've been very, very committed to sharing a needs-based approach because sometimes the governments are very much based on population. And so when we're looking at population, that doesn't consider what are the needs of the community. And needs can change from season to season. Needs can change from family to family. Needs can change from individual to individual. So it's been very important for us to collect data that's relevant to what we're working on and to collect it in our way. So it may not be front and center, this is the data and analytics of this project. It could be more of, this is the story we want to tell with this project. And so always taking that human approach is the goal that we've always committed ourselves to. And I think it's also helped to grow our small program into something that is more relevant to the community. So if we're not serving the communities, we're not serving ourselves.
In order to access funding to provide services to our community, we have to be able to explain the data in the Western way. Just knowing is never enough. I do agree that old ways are great, but the modern way of collecting data can support us in many ways. It will help us understand what we can improve upon, what needs to work, and what is not working, and then we can adjust our plans accordingly. In order to obtain the support we need through data professionals and other consultants, we need to know how to speak their language, and we also need to be able to compare what we're doing to what others are doing.
Well, data is not just all about numbers and the SMART objectives and whatnot that we've been, taught in some schools and courses and whatnot. It's sometimes you'll have a program worker who will come up to you and say, hey, David, guess what? So-and-so showed up today. He's never been out of his house in 10 years. We haven't seen him. He's there at our cooking class as an example. That's one. And there's so many people attending our full moon ceremony. It's amazing. So it brings, we're not there counting how many people were there. We're there just looking at them, seeing them participate, and knowing that, they are well and they're sharing their story. So that's important. Data is not just about the number. For sure, it's encompassed in a lot of the things we do, but it's not just about that. When I see our elders walking around at night because they feel safe, because their community is well lit, because the dogs are tied, that's another good, very good indicator that we're heading in the right direction. Well-being is very wide.